Complex Care is a NHS provider, and we look after children and young people within their homes who have a tracheostomy and ventilators. I also manage a core team of trained carers and also nurses, and they are skilled to look after these patients in the homes.
My role with children who are on a long-term ventilation or LTV pathway is to help manage them while they're in the intensive care unit. We know that these children often spend quite a long time with us, and so one of the things we try and do is allocate a specific named paediatric intensive care consultant to join them on that journey and to act as a main communication point for the family, so they have a single person to come and contact along with our extended stay team.
So my role is caring for the long-term ventilated children, and that starts from right at the beginning on intensive care. So right from the beginning we start talking to the intensive care unit, meeting the families, meeting the children, showing them around Ocean Ward, and eventually transitioning over to the ward. Once on the ward, you're there really to prepare for discharge home, and that involves a lot of different things really. That will be making sure the house is suitable for the 24-hour care that they require, care packages to provide that care, equipment, and any training and competencies that need to be completed.
We start their education, so we will start by educating families. Again, we're there for the consistent communication and a bridge between the ITU and the Ocean. We also look at the start of discharge planning and making sure that we are getting the discharge sorted nice and early to make a smooth transition to get to the board.
I did find it hard at first because obviously PIC is a different atmosphere. You've always got doctors straight there if something's to go wrong. There's always somebody sitting at the end of the bed, so that was a bit of a worry for me going to what I would call a normal ward. I spoke to the staff there, spoke to the ward manager, obviously put me at ease, saying about, this is the best thing for Aston to get Aston home.
So the journey starts off in hospital, and then once we are awarded the care package, the staff will go in and they'll start to meet the patient, start to learn about their routine, and then they are trained as competent, and then they follow the patient into their home settings. What it kind of looks like is if they are of a school age, then the patient can go to school, they can access education, whether that is nursery or whether that is school or college, and the staff members will also be with them.
So I work as part of a big team of lots of different professionals, right from the beginning of these patients' journey, usually when they're in the intensive care unit and we're thinking about whether long-term ventilation is the right pathway for them and their families to take. So we work with intensive care colleagues and colleagues from all sorts of different specialities in the hospital where children might need breathing support at home as part of their journey. And then we look after the children from a medical point of view once they leave intensive care. They often have other medical issues that we need to support with. And then once they've gone home, we see them back in the clinic and help continue to progress their journey, hopefully towards coming off ventilation, or if they're not able to come off ventilation, to live the best possible life that they can with that ventilation support going on.
I think as a sort of registrar team, a lot of our work is inpatient-based work, but we do get involved and attend the sort of outpatient side of things as well. And we often see the LTV patients from their journey from the beginning right through to the end. So actually the sort of decision making about long-term ventilation, tracheostomy, when they're on the intensive care unit, to being on a intensive care ventilator and then switching them over to a portable ventilator, moving them across to our complex care ward, and then sort of going through the journey of weaning the ventilator off, looking at all the other systems involved and actually working towards getting these children home to their parents.
So as physios, we get heavily involved with our families, and we're often picking them up and starting communication and treatment with their kids over on intensive care, and we follow them through to Ocean Ward here at Birmingham Children's. We also then manage them while they're here as an inpatient, but we also get involved with the long-term ventilation clinic, and we see our kids out in the community to help with carer training, as they often need respiratory equipment that needs specialist training.
So I came here from, I used to work in the community with LTV patients, trachea patients. So I came into, applied for this role and came onto the ward. It's looking after the same, like all trachea patients in the community, all trachea patients on the ward as well, but it's a lot more different just working as a team and supporting each other and getting to know the patients and just being part of their journey, being able to get them one step closer to home and seeing them grow. It's just nice.
So we cover all things education with our long-term ventilated patients. So we can still start the journey sometimes still while they're on PICU, so that's a paediatric intensive care unit. And then when they come over to us onto Ocean Ward, we continue the training with them. We train our staff, which is a mixture of nurses and carers. We sometimes support physio training as well. And we then sometimes take our children out into the community setting where we then continue some training with staff and with the family.
They prepared me for home, which was getting all my training done, letting me do day leaves with Aston to get me ready for home.
I joined the LTV team about 6 or 7 years ago as a clinical educator and spent a lot of my time teaching both staff and parents and families about how to look after these children with trachea and ventilators. This quickly developed into me problem solving for these families and staff both in the hospital and in the community. I loved this side of it so much, trying to make life easier for these children and families out in the community and home to have good lives out in the community doing the things they love. That's the direction I've taken.
So although we work all across the hospital, for the LTV kids we do a lot of work around housing and then a lot of work about commissioning to work out how children get the care packages that they need to get home. I suppose for me, my role is slightly different to yours. So for me, it's more about when we finally crack challenges, like finally get a family a house sorted, and finally after battling we'll get the right support for a care package for the family. And there's lots of different families we do that from.
We work with developmental communication and acquired communication, but we also work with children's feeding and swallowing, so making sure that they develop their feeding skills and that they have a safe swallow, and that might be that that's within the development phase, or it might be that there's actually been an interruption to the normal swallowing and we're trying to re-establish safe swallowing. But also we have a role in airway rehabilitation, which is a less understood role for us. So within airway rehabilitation, we're actually involved in initiating one-way valve placements, which looks at resensitising and rehabilitating the airway.
So I've been with the LTV for, I think, coming up to 8 years now. I've seen quite a few things, like I've took patients home that have actually been in hospital for so long, like most of their life really, and I've been with them, which I am still with this patient, and I've seen him just improve day by day, seeing him do different things, to actually just sort of lying in the cot to actually rolling and taking himself round the cot and lifting his head and lifting his legs to try and sort of look up, and yeah, just in general, seeing my patients improve to how they were at the hospital to actually being in their home setting.
I remember when I was in the hospital and I first got my wheelchair and I was just whizzing around the corridors everywhere, and everyone was like, wow! Everything is good, the carers are good, you should not be afraid. Like they have lots of good equipment, and you can put all your trust in them since they can get everything done.
You know, for me it's a really rewarding journey. It's only very short, but I'm looking forward to, you know, the future and the ongoing part of being part of this wider team as well.
One of my favourite bits of the job is helping to support these children go out on their first ever trips off the hospital wards.
It's been Sea Life Centre, took him swimming, took him to the pub. He's been Merrill, walked him around Merrill.
Went to the theatres, went to London, Sea Life Centre. Trying to Hooligan's House. All the landmarks everywhere.
But obviously weather's getting better, I can do stuff, and I do plan to do more stuff with him.
It's really enjoyable actually to see when you've had a child who's potentially been stuck on ITU for several months, to actually then progressing them onto a portable ventilator, and then that actually those children being able to go and have a sense of normality with their family and parents, and you know, that progress from a child who isn't really getting much enrichment from the environment around them with the sort of beeping noises, lights and things on the ITU, to actually then being allowed out into the big wide world, going to sort of Sea Life Centre, going home with their parents, and actually the ultimate sort of goal to get them home on a portable ventilator.
These children spend a long time in the hospital, particularly when they're little babies and infants, and it can be a real long slog for the families. And when they come back to clinic and they're doing really well, and they're going off to their school or their nursery and they come in their uniform, that's fantastic and makes it all worthwhile.
It's still not the same as children's services, but it's life. You have to grow up at one point of your life, but never be scared to do anything.
It's hard work, but it's rewarding. You know, to see them happy in home life, be, you know, doing stuff as family, integrating with all the brothers and sisters and stuff and other family members. It's nice to give them some normality, because obviously hospital life, it isn't the same. So yeah, just some normality, and that's what I've always wanted for Aston. I want him to have a normal life as much as he can have, as possibly can have.
Just have lots of fun, because you will have lots of fun.
Just take it all in, you know, don't try and run straight from the beginning. It's going to be so overloading with all the different high-tech equipment that we use. The tracheostomies is going to be really daunting because it feels so invasive. You have to change tracheostomy, you know, maintain that patient's airway. So just take it in, ask lots and lots of questions.
Ask loads of questions. Ask questions. Every question that comes to your mind, ask it.
My top tip would be to ask questions.
Always ask for advice if you're not sure about something.
Just ask, and also use the staff around you as well. It is a journey, so you wouldn't be expected to know everything from the get-go.